You take medicine thinking you are taking care of yourself, but little by little, he may be erasing his memory. Silently, he alters your mind. And the worst, you don't even suspect it. These pills seem harmless. They are in pharmacies, on open shelves, without the need for a prescription. They are the most common in the daily lives of those looking to sleep better, relieve pain, or control a symptom. But what few people know, some of them are directly linked to accelerated memory loss. Yes, science has already proven they interfere with substances that are fundamental to the functioning of the brain. They can affect your concentration, your mental clarity, and over time, they contribute to serious cognitive decline. At the end of this video, you will meet the worst of them. The number one, the most dangerous, the most present in the homes and in the hearts of those who just wanted to feel better. And the best part, we will show you 3 scientifically proven foods that help protect the brain every day, naturally. Today, more than 55 million people worldwide live with dementia, and every 3 seconds, a new story begins. Someone who starts to forget names, lose objects, confuse paths. Many people think this is normal. That comes with age, or is in the blood, inherited from the family. But the most recent studies reveal another truth. It's not always time that's taking the memory away. Sometimes they are medicines, common remedies, the kind we keep in the kitchen drawer, that are there within reach and of oblivion. Now that you understand what could be at stake, let's get straight to what really matters. The 9 medications most associated with rapid memory loss, according to scientific evidence. 9th, first-generation anti-allergics, antihistamines. You've probably used or know someone who takes Benadryl or similar. They are used for allergies, flu, or trouble sleeping, and sold over the counter, which gives the impression of safety. But what few know is that these medications block acetylcholine, a neurotransmitter essential for memory and learning. Over time, this can cause frequent forgetfulness, mental confusion, and even shrinkage of areas of the brain. For those with more sensitive brains, such as the elderly, the effect can be devastating, even if it seems harmless. 8. Benzodiazepines, Xanax, Valium, lorazepam, Rivotril. Prescribed for anxiety, panic attacks, or insomnia, they work quickly and provide relief, yes. But when used for a long time, they act like a brake on the brain. A study published in BMJ showed that continuous use of these drugs can increase the risk of Alzheimer's by up to 51%. The signs appear little by little: difficulty in reasoning, untimely drowsiness, slower memory. And they are often confused with an age thing, Siedme proton pump inhibitors, PPIs, omeprazole, pantoprazole, esomeprazole. They are the favorites of those who suffer from heartburn, reflux, or gastritis. But continued use can block the absorption of vitamin B12 and magnesium, 2 crucial nutrients for the brain. A study of more than 73,000 elderly people in Germany found a 44% increase in the risk of dementia among regular users. And the most worrying thing, many take it for years without monitoring. The stomach discomfort disappears, but the memory lapses appear. 6. Antipsychotics, risperidone, quetiapine, olanzapine, indicated to treat behavioral disorders, delusions, or symptoms of dementia. But there is a paradox. These medications can worsen the very problem they are trying to control. They reduce brain activity, bringing sedation, apathy, and worsening cognitive function. The FDA, the American Health Agency, has already warned about the increased risk of death in elderly people with Alzheimer's. And even in those who do not have dementia, prolonged use can cause loss of autonomy and functionality. Fifth, Z drugs, sleep inducers, zolpidem, Stilnox, eszopiclone, Lunesta. They are popular among people who have difficulty sleeping. They put the body at rest, but they don't let the brain rest properly. These drugs compromise REM sleep, the phase in which the brain organizes memories and restores functions. Result? The next day, you may feel more confused with difficulty remembering simple information and a constant feeling of mental fatigue. Sleeping is not the same as resting your brain. Sturdy tricyclic antidepressants, amitriptyline, nortriptyline, widely prescribed for depression, migraines, or chronic pain, especially in the elderly. But they have a strong anticholinergic effect. This means they also block acetylcholine, directly impacting mental clarity and focus. Study of people showed that the risk of dementia increases depending on the dose and time of use. What starts as a mood booster can end up as a trigger for forgetfulness. Third, medications for overactive bladder. Oxetrol, tolterodina, sulfasenacin. They help control urinary urgency, something common with advancing age. But there's a price. These medications also work by blocking signals in the brain. A study by the University of California showed that elderly people who used these medications had smaller brain volume and worse performance on memory tests. And because they are considered maintenance treatment, they remain unchecked for years. Second, statins, atorvastatin, simvastatin, rosuvastatin. They are essential for preventing heart disease and controlling cholesterol. But there is one part that few people talk about. The brain needs cholesterol to produce neurotransmitters such as serotonin and dopamine. Some patients report mental fog, memory lapses, and difficulty concentrating. And a study published in Pharmacotherapy revealed that 75% of patients who discontinued use reported cognitive improvement. 1. Combination of anticholinergics. This is the most dangerous of all and also the quietest. It's not just one medicine, but a combination of several for flu, nausea, colic, insomnia. Together, they generate a cumulative effect that drastically reduces acetylcholine in the brain. A study of more than 3,400 elderly people followed for 10 years showed prolonged use of these compounds increased the risk of dementia by 54%, even years after stopping. The problem, they're everywhere, and almost no one realizes they're mixing it up. Science has spoken clearly and lovingly. We listen for you. Study after study reveals a scenario that needs our attention. A survey published on JAMA Internal Medicine identified that the continuous use of anticholinergic medications, common for insomnia, allergies, and even depression, can increase 54% risk of dementia. The British Medical Journal pointed out that the so-called Z drugs used for sleeping are linked to episodes of mental confusion and increased risk of falls, especially in older adults. An analysis of the magazine Pharmacotherapy showed that 75% of people reported improved memory after controlled cessation of statins, widely prescribed cholesterol medications. And researchers from University of California found that certain overactive bladder medications are linked to a measurable brain shrinkage with direct impacts on cognition. These data are not an exaggeration. nor are they an unfounded alarm. They are a call from science to look more carefully, more affection, and more responsibly at what we put into our bodies, especially as the years go by. Because living well is not just living longer. It means living lucidly, safely, and autonomously. Now that you've seen the villains, let's talk about the heroes. 3 scientifically proven foods that help protect your brain and even reverse damage caused by medications. 3. Blueberry called brain fruits, powerful antioxidants that reduce brain aging. Study: memory improvement in just 12 weeks. 2. Fatty fish, salmon, sardines, mackerel, source of omega-3 DHA, essential for brain health. People who eat fish every week have up to 60% less risk of Alzheimer's. 1. Dark greens, spinach, kale, chard, rich in vitamin K, lutein, beta-carotene. Do you eat 1 serving a day? Brain performing 11 years younger. Dementia does not come on suddenly. It insinuates itself into small forgetfulness, confusion, lapses. But now you know what could be behind it, and most importantly, what to do about it. Review your medications with your doctor. Start including protective foods in your daily life, and share this video with someone who may be at risk without knowing it. The brain doesn't warn you before it collapses, but you can act before that happens.